For me, dentistry has always been something that has given me fulfillment. Even as a young child, I used to watch my grandfather. He was a dentist, and I'd watch him in his practice. And I thought, just the way that he made his patients feel was something that I knew, right then and there, that was something I wanted to do in my life. And then when I was probably like in 5th grade, I broke my front tooth, and my dentist was amazing, and he fixed it, and it looked great. And I went back to school the next day, nothing happened. From that day on, I knew I want to be a dentist, so I can kind of provide the same thing for my patients. I went to dental school at NYU, and I at first thought I wanted to be a pediatric dentist. And after a year of doing practicing dentistry after dental school, I really realized that I love general dentistry, and I like to do a lot of cosmetic things in terms of veneers and crowns, and didn't want to just limit myself to pediatrics. Through my continuing education, especially with SPEAR, that kind of looked at the nitty-gritty of how we prepare a tooth and why we prepare it a certain way. But then it starts to kind of go out to the big picture of the whole patient's mouth and their function. And from there, I started to get into airway, which is a really kind of upcoming field in dentistry. We're looking at, patients' positioning and sleep and snoring and all of that, and how that affects their overall health. And that's why we brought on the photonal laser into our practice, to help really basically open up the airway for patients so that they can mitigate their snoring, and that helps with a lot of patients that are suffering from sleep apnea. And then that blossomed into cosmetics. So we're doing a lot of laser for the skin to tighten up wrinkles and in a very non-invasive way. So that's something that a lot of our patients really gravitate towards, as well as adding Botox for therapeutics. So giving our patients therapies that will help them overall, and in an environment that is comfortable and familiar to them, because a lot of times they're going to be bounced around from different doctors. A lot of the things we can take care of for our patients in office, and if we don't, I work with a lot of wonderful specialists that I'm very comfortable with sending my patients where is going to be best for them. The most rewarding aspect is really just building a rapport with a patient, especially somebody who's anxious or has had traumatic experiences in the dental chair. That's a really big thing for a patient to come in and put their trust in you and look for some answers, and just making them feel seen and heard, and giving them a place where they are comfortable and that they keep coming time and time again. I think that's really the most rewarding thing, is that they're doing the best thing for their care, and we're able to facilitate that for them.